There can be so much guilt and embarrassment when we can't participate in intimacy and or we just don't want to, right? So intimacy and sex is a whole big topic. You need mind readiness, you need spiritual readiness, someone that you want to be intimate with, and physical readiness. And this video is going to focus all on physical readiness and how to make it better for you. So if you feel like you have to grit your teeth through intercourse, then this is going to be the video for you. We're going to talk about how to improve your own body, your own pelvic floor, so you can engage in sex and intimacy the way that you want to and not have to grit your teeth through it. I'm Dr. Allison Felt. I own Body Motion Physical Therapy, and I'm a pelvic expert physical therapist helping women improve the health of their pelvic floors. I want you to like and subscribe to this video and get all the pelvic floor content that we have to offer you on our YouTube channel. So let's get started. 3 tips in order to help you improve your sex life are all going to stem from improving the quality of your pelvic floor. So this is your pelvic floor. The pelvic floor is 3 holes and is 3 layers of muscles. We have the anus where we poop out of, we have the vagina, and we have the urethra where we pee out of, and of course the clitoris as well. So this whole pelvic floor is responsible for our experience with sex and intimacy. And so I want to teach you how to optimize your pelvic floor so that sex can be better for you and things can feel better. A lot of the time, the pelvic floor is in a tightened position. So it's more contracted. And that tends to be how women live their life, is with a more contracted or shortened pelvic floor. When that happens and the muscle isn't getting to relaxed states, then we lose blood flow, we lose natural lubrication, and we lose the pleasure sensation. And we just don't have as much good sensation to those areas. So I'm going to teach you 3 tips of how to improve your pelvic health function and your pelvic floor function so that sex feels better and intimacy feels better. Okay, the very first thing is about how we hold our bodies in space. So a lot of times I see people that clench their glutes, or during their workday, even when they're sitting, they're kind of semi-clenched, okay? So even when you're doing the dishes or working on your computer, things tend to tighten and clench, and sometimes we posteriorly pelvic tilt, or we'll hang out here and we let our glutes do this like semi-contraction all day long to hold us up. Well, we need to work on unclenching those glutes, because every time that we're fully clenched and engaged, our pelvic floors are fully clenched and engaged. And if our pelvic floors are fully tightened and clenched and engaged, that isn't going to make it like a tighter, better experience. That means that our pelvic floors are going to be shortened, the tissue becomes more fibrotic, and there is less blood flow. So we want to improve the blood flow and lubrication to this tissue. We have to work on relaxing and opening it. And actually, the muscles are stronger when they're in this more relaxed and open place, and it's a better sensation for you and for your partner. And so the very first thing to do is to start relaxing the glutes. So if you are clenching your glutes, I want you to go ahead and relax your glutes. All right, the second thing you can do is diaphragmatic breathing. So that's a breathing where you breathe into your abdominal region. So you take a nice deep breath in and exhale and let the air go. When you do this type of breath, the diaphragm that lives under your rib cage in this domed umbrella-shaped shape is, when you inhale, that umbrella flattens or becomes more of an upside down umbrella. And then when you exhale, it goes back to its umbrella state. Well, the pelvic floor is mimicking the same movement. So when you inhale, the pelvic floor opens and elongates, and then when you exhale, it recoils. So if you can develop a connection with your diaphragmatic breath and sensing the opening of your pelvic floor, that's going to help drastically improve your sex life. A lot of times during intercourse, we tend to brace ourselves or hold ourselves rigid, and that's going to make things tighter, and not tighter in a good way for your partner. It's actually going to make things more uncomfortable. So we want to work on establishing this connection where the pelvic floor can open and relax in regards to our breath, and that's going to help improve these muscles for intercourse itself. So again, we're going to take a nice deep breath into our bellies. When you inhale, think about the vagina opening and vulva opening. Exhale, and you get some recoil. Inhaling and opening, and exhale, you get some recoil. If you can't sense that or you have no sensation of that, I want you to go ahead and place a finger right next to the vagina or right next to the vulva and do this type of breathing. You can also just stick a finger right inside the vagina and see if you can feel that opening when you go to inhale. And so you inhale and open and exhale. You get that natural recoil. You should do this every day for 5 minutes a day, and this will help improve the position of your pelvic floor, again, improving your experience with sex. All right, our third position. We're going to go ahead and do this type of opening and stretching of the inner thighs to help relax the attachments to the pelvis. So this is a very nice, gentle stretch, and you're also getting some stretch of the fascia. So you can hold this for about 5 minutes, maybe 7 minutes, and this is going to help with the opening of the hips, opening of the pelvic floor, and you can even incorporate the breathing from our last position into breathing in this position. So you can go ahead and you can combine them. You can do deep breath into belly, pelvic floor opening, exhale and letting it go, inhale and open, exhale and let it go. And again, you're holding this for 5 to 7 minutes. So we covered in this video 3 different tips in order to help improve your sexual experience physically. And if you incorporate this every single day, you are gonna have better pelvic floor function. If you like this video, please hit the like button and subscribe to our content. We put out 2 videos a week, all in regards to pelvic floor health and living your best life as a woman. We believe that the secret to avoid peeing your pants, achy joints, joint replacements, bladder surgeries is pelvic health function. And so the better your pelvic floor operates, the better your core is going to work for you. So thank you for tuning in. I'm Dr. Allison Felt, owner of Body Motion Physical Therapy, and I'll see you next time.